Thank you, Holly. Good morning, everybody. Welcome to Talk Tuesday, January 7th, and it's hard to believe it's 2025. We hope everyone is having a happy new year so far. We were just discussing this earlier, how quickly time flies. But we do have an exciting presentation to set you off into the new year, give you some things to talk about, some great content, some work in the districts that I think you're really going to enjoy seeing what's being implemented. So let's get going for Talk Tuesday. And I want to welcome you here today. I am Christine Killiland. I'm a consultant at the State Education Resource Center, known as SERC. I'm here with my colleagues, Anne-Marie Cardisco and Holly Ryan. But we are also here with our CSDE colleagues and partners, Carly Sullivan-Custer, Jay Brown, and Kim Traverso. We have a very special presentation on comprehensive mental health and wellness and what that looks like in the Norwalk Public School District. We are here with Robert Pennington, Assistant Superintendent of Schools from Norwalk, and Dr. Robin Granger, social worker in residence at Norwalk Public Schools. I will wrap up towards the end with just some quick, just any announcements and highlights to think about. But we want to get going. We want our presenters to have a lot of time. As always, here is the Superintendent's Digest. We have the QR code if you do need it to look into any of these resources a little further, or the link. There was nothing for January yet because the new year just hit, so they do not have anything out, but these are the last few things in Superintendent's Digest from the month of December. So if anything kind of interests you, we have applications for regional school choice. There was the U.S. Department of Education, a civil rights release, a resource explaining civil rights implications of schools, especially with the use of AI. There was a really neat document December 9th on educator recruitment by the numbers. And I know some schools are, always looking for recruitment or for certain areas that are in need of hiring. So this document might be of help to you. The FAFSA completion status is now available. I believe that's through February. And CSDE also put out some legislative proposals. As many of you are aware, I believe it is tomorrow is the start of legislative session. So those proposals are going to be talked about. Hearings are going to take place. It's great to be aware of kind of what's on the horizon for legislative session and what you might be interested in. And there was just a recruitment access for schools from the CT National Guard document as well. So if any of these things do interest you, QR code and the link is also embedded. And I'm going to now turn it over to Carly Sullivan-Custer.
Morning, everyone. It's wonderful to see all your friendly faces. Happy New Year. I hope everyone had a nice, relaxing break from school and all of work and back ready to go. Next slide, please. I always start with the data. And so from our EdSite attendance dashboard was updated just before the holiday with November data. And typical for the last couple of years, we do see an uptick in attendance and chronic absence in November, and then again a little bit in December, and then we start to come down as we go through the spring. But we did have a chronic absence rate of 18.5 across the board in all of these student groups. They're up about 2 or 3 points from where we were in October, but we're still trending lower than we were last year, and we'll see that on the next slide, please. So you can see that little, because the numbers are so small, that jump looks drastic. It really isn't that drastic. We're still lower than we were last May and where we were last November. Your hard work is paying off. You're paying attention to students and the needs and the reasons that they're missing school and how we can help them in an individualized relationship way. And we are very grateful for all your hard work and helping to have kids come to school every day. I know that January 2nd and 3rd were tough days for attendance. I'm sure your average daily attendance took a little bit of a nosedive coming back on a Thursday and Friday, and many school districts having Monday off. And so that's behind us, and we're going to work on improving attendance going forward. So next slide, please. This is chronic absence for our high need versus non-high need students. We always like to look at both groups of students. Non-high need, I mean, high need students include students with disabilities, free reduced lunch, and students who are English multilingual learners, which you can see is a 24.4, still lower than last year, but still way too high. So we still have work to do. Next slide, please. As always, it's Talk Tuesday, so get your fingertips or your microphone ready because I want to hear from you. We all want to hear from you so we can learn from each other. So, wondering, have you observed any seasonal or health related attendance trends since you come back to school in the last couple of days? And how are you planning to mitigate these? Are you seeing lots of flu? Are you seeing kids just not wanting to come back because it's cold? It'd be helpful for others to know in the chat if you want to just list like some of the trends that you're seeing now and maybe some of the ways that you're planning to mitigate these. Give you a few minutes. If anybody would like to share, feel free to speak up.
Hi, I'm from Wallingford Schools. What we're doing is we're making a flyer with "Are you well enough to come to school?" To send out to blast with each school's logo and just basically like 3 little notes, but also just encouragement around there. We miss you. We can't wait to see you. You belong here, type of thing. That me and Michelle and Mackenzie are working on right now to just put out there. You know how it usually is. You're not well enough to go to school, or we're trying to put a spin on it to make it more positive. You are well enough to go to school.
Yes. Yes. We're trying to change those, the messaging from COVID when everybody was staying home no matter what, right? That it is okay to go to school with a cough. If you have a fever, then you need to stay home until the fever's gone for 24 hours. Thank you, Wallingford. Vacationers who aren't coming back, pneumonia is on the rise. Hi, good morning, Nushet. Norovirus, a lot of illnesses. And so I love Wallingford's proactive messaging to families. Does anyone else have any ways that they're trying to mitigate these, that they're thinking of doing, or that they think might be helpful?
We've been seeing a lot of cases with pneumonia, even whooping cough, which is like something that I haven't seen for a long time. But and a lot of the families also, they had extended vacations because of the Three Kings. So we tried to mitigate that by telling them, come on. But but we've been talking, we've been sending out flyers, we've been sending a lot of parent links, which is really good. Positive, everything positive, not negative, not sounding out the negative. So we've been very positive with our messaging with families, which has been working. So we've been getting a lot of good feedback.
Right. We know nothing grows in the garden of shame, right? And so we're trying to shift our mindset, be supportive and empathy with families versus punitive around you're truant or you're bad because you took a vacation. Some families may need to take that vacation, and maybe something that helps their students and families' mental health, and so that when they come back, they're ready. But we need to be understanding of the why students are missing school and how we can support them. Thank you, New Haven. Here we go. Ruth, thank you. We planned a welcome back dress to impress New Year's dance party for January 2nd to motivate all well students to be in school. Got the idea from the last meeting here. I remember that discussion, like, let's celebrate the new year on our first day back to school. We're going to have a party or a dance, and we're going to all celebrate and kick off the new year together. I'm glad that was successful. I think that's Westbrook. Thank you, Ruth. Nicole, I can help you with the doctor's notes because I could go on and on about excused, unexcused, and I'll reach out to you and we can talk about the doctor's note around students being absent. But most importantly is that you have contact with the family and that you understand why they're missing school, and that whoever spoke with the family makes a note in the file that they understand that the student was sick and that they are excused or unexcused. All right, I just have one more slide. And what steps are you taking to ensure strong communication with families about the importance of regular attendance during the colder months? How are you communicating with them? Are you, we heard from Wallingford that they're creating their own How Sick is Too Sick for School. How else are you communicating with families? Are you doing any kind of text messaging? Are you sending notes home with students? Are you communicating with students themselves so they know they can come to school if they're not feeling well? But it's really important at this time of year when it's very cold out, there's a lot of illness, to be sure and talk to families about why it's important to come to school, but also to make sure school is something that kids want to be at and that they feel welcome, and what they're learning is something that's of interest, and they feel part of the community. So I'm not going to, if you have any thoughts on that, please share so others can learn from what you're doing, and we can all gather this information and share it together. Lori Beth in New Haven has sent out a phone blast, but she's also spoken with parents during parent chats and PTOs. Thank you. And the next slide, I believe, is my last. Kenneth, we did a letter before break and did a welcome phone call to the district from the principal before they came back. And also, I know, Kenneth, you have a nice presence on social media that's very fun and exciting. And I follow and like. So, use social media. There are memes and graphics and all kinds of things you can use on our School is Better With You campaign website. There's a toolkit where you can use the artwork and put your own logo and put your own spin. Winter resources for addressing attendance. I just wanted to make sure that you all had these at your fingertips. So, of course, Attendance Works has preventing absences in winter months resources. We have our Bright Spots Connecticut report that's focused more on high schools. The CDC guidance is here at your fingertips now so you can go see their guidance. Also, the attendance attendance dashboard, the monthly data that's new, will help you analyze absenteeism data to identify trends and plan interventions. Again, our School is Better With You campaign is Connecticut focused. There is a flyer on there, How Sick is Too Sick, that's ready for you to just download and send. We thank New London for giving us that idea. And then, of course, Talk Tuesdays, where we learn from each other. So please share in the chat if you have any ideas on what schools could or should be doing, what's successful in your district, so we all learn from each other. Next slide, please. This is the School is Better With You. I just put this here so you see like what kinds of things. There's an FAQ, which will help you answer questions that families might have. There's a tip sheet for morning announcements. It's in English and Spanish. There's a wonderful flyer from Attendance Works. Is your child missing school due to anxiety? So just a reminder that this is here, and here is the link. Next slide, please. And this came out just yesterday, so it's not up on the Superintendent's Digest yet. And I put this last, so when I do my friendly handoff to my colleague Kimberly Traverso, if she wants to add anything else about this new initiative or support system, very important support system for students and families, called Handle with Care. And it's an alert system initiated by first responders for students who are exposed to trauma-inducing experiences outside of school, where they will notify a designated school administrator that this has happened. I don't know a lot about it, but I do know there is a virtual meeting on January 28th coming up. Wanted to make sure that you guys were aware of that. I'll put the link in the chat once I'm done talking, but it's very important so that there's communication. I've heard this before. We don't know when a student has had an issue or anything. So this is really important work. And so with that, I'm really excited to turn it over to my colleague, Dr. Kimberly Traverso, who is our education consultant for all things school counselors, mental health, discipline, and overall awesome person.
Oh, Kari, you're the best. Hi, everyone. It's great to be here. And the feeling is mutual, by the way. I am so excited. First of all, Happy New Year, everyone. Welcome back. And I hope you can hear me okay. I am very excited about Norwalk Public Schools presenting today. I have basically tapped into them quite a bit this year because they're doing some incredible work around coordination, around collaboration, but not only internally, but externally. And the reason why we actually found out about all this great work is because we actually have something here at the State Department called the Behavioral Health Pilot. And the behavioral health pilot started a few years ago, and it was based on our commissioners' audacious goals. And one of them was around mental health. And one of the issues that came about, and how we found this out actually, is through a landscape survey that we send out to districts. And many of you probably remember this a few years ago when we're asking key questions about how well is your referral process working internally and externally for mental health referrals? How connected are you to your community providers? Do you actually have community providers, and where are the gaps? And also, are you doing any kind of resource mapping to find out exactly what the needs are to ensure that we can address those needs in a systemic way? And so the behavior pilot actually started because of all these great questions and the responses back and from focus groups and also from the survey. So one of the things that we really wanted to do, number one, was to build and create scalable and sustainable systems in a coordinated fashion. And how were we going to do that, especially in some of our even smaller districts in rural areas where they didn't have any contact with outside community providers for maybe an hour away? So how do we coordinate these efforts and get the support that we need in the schools, but also our large scale schools like Norwalk or Waterbury? And how do we make sure we coordinate our efforts? So one of the issues that we wanted to also make sure that we addressed was how do we coordinate not only the mental health needs, but more of a preventative early intervention model, addressing the needs before we actually scale up in supporting like tier 2 and tier 3 supports. And one of the things that we introduced in this pilot was called the School Health Assessment and Performance Evaluation System. I know a lot of words, but in simple terms, it's called the SHAPE. And it's a platform that anyone can utilize for free, which I love free, and it is evidence-based. So you can literally do an assessment and find out how well your district or school, because there's an assessment for district-wide and there's an assessment for school-wide. And actually, I think, Robert, you and Norwalk, you not only did district, but you also did some school evaluations as well. And the individual assessments were called the mental health quality assessments. And so, again, we really are looking at systems, and we're looking at something like teaming. How are we identifying needs and resource mapping? Again, who's responsible? How much money do we have going towards this? How do we know it's working? Also looking at screening, and I know that Norwalk also uses the DESA, the Devereaux Student Strength Assessment. So that's a tier 1 universal screener. And then we also look at how do we promote mental health and services before we get, again, into that tier 2, tier 3 territory. And finally, I want to just add, of course, in this, you have to look at human capital, but you'll have to also look at fiscal capital. And so looking at how much resources you have to put forth to train staff, to actually have a communication plan on how this is going to roll out so that you're having the impact that you need. So this actual comprehensive assessment looks at all of that. So if you want more information about that, feel free to contact me or Norwalk. I'm sure they're going to put their information on here, but we are very excited about this pilot. We will have information report that's going to go out regarding all the great information regarding best practices so that districts can actually put this into practice. So I'm going to stop there, and I am going to turn it over to Norwalk, to Rob, and I think Bob and Robin are here today, and I am going to let them tell you their wonderful, wonderful story because we're very proud of the work that they've done. Rob?
Hi, good morning, everyone. I'm Rob Pennington. I'm the Assistant Superintendent of Schools in Norwalk, and with me is Dr. Robin Gredinger. Robin, do you want to say hello?
Hi, good morning. Thank you so much for having us here today.
And she's our social worker in residence, and it's actually a position that was created because of the behavior health grant. And it's a one-year position that allows us to build out some of the work that we needed to do through this system. A little bit about Norwalk is we have 11,564 students. We have 23% multilingual learners. In looking at our prevalence rate from pre-K-12, we're at 19%. If you were to look at K-12, it is around 17.4%. And then from our race ethnicity, we are roughly 63% Hispanic, 21% white, and 13% African American Black. So the behavior health pilot really has allowed us as a district to take a look at our overall behavioral health systems post-pandemic. We saw a huge increase in needs. I'm sure other districts across the state saw that as well. And so we started off by completing the SHAPE assessment for the district, and it gave us some really great initial data. But one of the pieces that we realized is we have 21 schools. And so we ultimately said, what's happening at the schools? If they were to complete this, would the results be the same? Would we see different components? And what does that mean? And so when we look at our SHAPE assessment results, we can look and we can see some variance between the district and all schools, but we really were able to target some specific areas that were both low for the district and low for the schools. Mainly needs assessment, resource mapping, and screening was another area. And so it allowed us to then target where we were going to focus our efforts and how we were going to do this. One of the other components really is tied into DESA, and Dr. Gredinger is going to talk a little bit about the DESA because it wasn't something we had in place prior to the behavior health pilot.
So one of the things that had come up, as you guys could see in the results, is that we didn't have a screener for our mental health for our students, especially K through 8 was our focus. And you can't really provide intervention if you don't have a screener to figure out what's going on. So we really leaned into the DESA, which looks at 6 different areas. It's 8 if you get into the high school. And what we were able to do was start to communicate with our administrators about the DESA rollout, the importance of why we are doing this. We're doing it, we're rolling it out 3 times a year as well. So that way we're getting good information to see if kids are having any growth. K through 5 is a teacher evaluation form where the teacher fills it out. And then 6, 7, and 8 is a student self-report. We've been able to get some really good data to dive in to see how our kids are managing through social situations, how they're dealing with their own relationships with themselves and with others as well. So we really first moved forward with the screener and then making sure that all of our leadership understood the reasons for the DESA and how we would start to implement it afterwards.
And another area tied to our wellness screeners is the use of our school counselors. They are crucial in this role. And we have built out a system where all school counselors, grades 8 through 12, are meeting with all of their students at least 3 times a year. And this is, we've been able to track this data to see what are the different areas they're meeting with students around to build out some of those support structures that are needed. We also built out workforce development lessons and social emotional lessons in our middle school. But I really think that involving our counselors into this process has really allowed us to be proactive versus reactive when a student is having some concerns. And one of the pieces that was important for us was to really develop a mental health and wellness team. We really were strategic in our naming of the team as well. We wanted to make sure social emotional learning kind of became a buzzword. And so it's more than that. So we really focused on mental health and wellness. And this team really consisted of many stakeholders throughout the district and the community. So we had administrators, we had members of our data team, we had our community partners, we had counselors, social workers, multilingual learning teachers, special education teachers, but it really was this full comprehensive team to help and develop the work that we needed to do.
So one of the things that we started with in terms of the work was, Mr. Pennington alluded to it, so much we hear about social emotional learning, social emotional learning. Often we got feedback from our teachers and our educators when we were going around the 21 schools to assess, oh, well, that's SEL, that's not our job. And really, this is something that looks at a whole child, and it is a part of what we do. So we wanted to kind of reframing how we talk about quote unquote SEL and looked at it as mental health and wellness. So then we decided that we really needed to come up with a vision to drive the work that we're doing. And we really felt that it was important to include not just our families and our scholars, but also our staff. When we looked at the data, we were making sure that educator wellness was also one of our priorities, because we recognize that if you can't put the mask on yourself first, you're not going to be able to help out our students. So we really developed a vision statement that talked about some keywords I'll put in: that they thrive academically, emotionally, and socially, and that we're prioritizing essential life skills, emotional intelligence, interpersonal relationships, and resilience for all of our students. I alluded to the whole child. One of another ways that we are pushing out this work is through the Whole Child Initiative. The Whole Child Initiative is really designed to be relationship-centered learning for students and creating those environments for them. It's having educators look at the child as a whole as well. And really, when we look at creating more of a comprehensive tiered behavioral health system, we are creating equity for all of our students here, and especially for our marginalized populations that may not have access to services. So when we talked about what are our action plans going to be, what are the things that we want to focus and hone in on, we had a few things that came out of the SHAPE assessment that we decided that we really wanted to make a priority. So we expanded our community partnerships and our school-based services, which we'll talk about a little bit more. In addition to that, Kim referred to our resource mapping. That was something that we had done when we went through in terms of a needs assessment, was looking at what are the things that our families and our students need access to, and how are they able to find that. In addition to that, we looked at implementing a K-8 comprehensive mental health and wellness program by providing Tier 1 support for all of our teachers with programming that they can have to access for their students on a daily to weekly basis, depending upon if it's the middle or the elementary school. In addition to that, we made sure that the DESA and our universal screeners was something that everyone was focused on, looking at a whole child. When we're looking at a child who's struggling with math, we also want to make sure, are there any emotional things that are impacting that ability to learn? In addition to that, we also look at the attendance, which we'll talk about in a little bit as well. And then we have developed our MTSS behavioral health system support in terms of looking at what are we using to determine when a student enters into a tier 2, and then how do we have them move throughout those tiers as well. In addition to that, we also provided all of our educators K through 12 access to adult wellness supports that they can go right on in and be able to take care of themselves, and some of the skills that they can learn they can also do with their students in the classroom. In addition to this, we'll talk a little bit more about our community and school collaborated trainings as well. So the first thing that we did was, originally everyone talks about Castle's what's the driving force. But when we talked about, and DESA aligns a little bit with Castle, but when we looked at the MTSS system itself, they're really looking at the components of social and emotional and intellectual habits from K through 12 for students. So we really said, okay, there are these different areas. How can we align with the things that the DESA is assessing to these areas, so that way we can make those connections for our educators and also for our students. So we were able to kind of set this up where if we knew that a child had an area of weakness in the DESA around, let's say, social awareness and relationship skills, then we would be looking at an intervention around interpersonal skills.
One piece that I forgot to mention, so I do want to make sure to mention, is CHDI was an amazing partner throughout the entire process. We had monthly meetings with them, and they would come in and we would look at our data and we would have these conversations, and we would really be talking about what could this look like and what would be different ways that we could approach the work. So I just wanted to make sure that I shared that without them, we wouldn't have seen some of the successes that we have been able to see. Now, one of the important components for us is how do we make sure that things like the DESA data really make its way into our instructional leadership team. And so our team really developed this, what happens during ILT, which is the instructional leadership team at the building level. And we broke down different components, and you can see that through our SRBI team, there's WIN data, progress monitoring, but DESA lives there. We also have our supportive environment data and work that is being looked at, which brings up information from the school climate committee, child study team, but also our panorama surveys. So really being intentional that during our instructional leadership teams, that we are looking at this data and making decisions to best support all students. And so it's not just looking at NWEA, SBAC data, DIBELS data, but really making sure that when we talk about the whole child, that we're looking at all different types of data to support all students in the school.
What's really nice about Norwalk as well is that we have created our own Norwalk data dashboard. So when we went around to K to 8 schools for district instructional leadership team rounds, we were able to utilize our dashboard that has all of our academic information in there, but also the DESA rating scales are in there, in addition to attendance. So you really are able to get a pull on a whole child and see how they're doing across the board. So this year, our instructional leadership team, we asked all of our school mental health professionals to attend, which is different than in the past. So because we are looking at the DESA data and a whole child, we do feel that we need the whole team there to look at that. So we went to all K to 8 schools. We are doing that 3 times a year. We have our SRBI coordinator, our data analysis for the district, and then myself goes in to help support this and to talk about how do we look at the DESA data? How are we going to build a tier 2 to support this for them? So that's been really helpful in terms of having the teams know where we're going and having their eye kind of on the prize in terms of understanding what we're doing with the DESA and how we're incorporating it within the academics and helping our kids thrive in the academic setting.
So in terms of, qualitative impact, I think we had a really strong academic SRBI system. And I think through this process, we've really developed our behavior SRBI system as an area. It became an area of focus for us as an organization, but we have been able to see some really positive impacts over the past 2 years. One of them, we give a student use survey and partner with one of our partners to students in grades 7 through 12. And if you look around depression and suicidality in our Norwalk youth over the last 3 years, we can see that our numbers are dropping. I mean, goes back to the first one was given in 2021, which was really just at the end of the pandemic, which we saw record highs, but we've been able to see decreases over time. When we look at our chronic absenteeism data, we're constantly analyzing this, and we do have a district attendance team, and each school has their own attendance team, but we're seeing decreases there. I mean, over the last 3 years, we've gone from 26.8% to 21.1, like down, whereas in December we're at 15.9, and that's something that we're really excited about seeing, because we know that it is a leading indicator for a district to analyze. And so that is something that we are constantly looking at, and we see that decrease. But then we also look at some of our behavioral data, which I think is important. And we've had a 5.7.2% decrease. And we have some really specific schools that have seen amazing growth and want to celebrate them. And some of them, like West Rocks in particular, they are currently doing I would say a next step with CHDI moving forward. And we've seen a 53.4% decrease in overall incidents at West Rocks. And they focused a lot on tier 1, and we're really excited and want to celebrate them. And just seeing this impact so far, there are a lot of other systems as well that are working towards this, but it's all interconnected, and I think it's important that we share. Now, I do think one of the greatest strengths of our community is our community partnerships, and there are many different organizations that we have been able to partner with to develop and to build out some of this work. The student use survey I mentioned is a partnership with Positive Directions. Our largest partner is Mid Fairfield. We partner with the city. We have Triangle Community, but just really a lot of amazing partners here in the city that we've been able to build systems through the behavior health pilot that has really helped to target some of this work in our schools. And so you can see throughout our different schools where we have different pieces. Go ahead, Robin.
So making sure that it's a really good marriage between Norwalk Public Schools and our community agencies has been something that has been one of our focuses this year. We are very blessed to have 3 different agencies that have either school-based health centers or school-based clinicians embedded into our schools. With that, we have created these really great working relationships, because they're not just a separate entity that comes to work in the building. They really are a part of our community. So we have really made sure that we partner with them. We have monthly meetings with them to check in and see how things are going, if they're having any issues, if they have any concerns about kids. When we have kids that are really struggling, we're talking about our tier 3 that are in high need, we now have the ability to contact directors and say, I have a need, it's really high, there's safety around this. How quickly can you get, this child seen? So that has been a wonderful thing that we have worked on and developed, and we're very, very lucky. We have longstanding relationships with kids in crisis. We have clinicians that are embedded into our buildings there. And it's been really nice to look at providing Triangle Community Center supports for our kids, not just in the high school, but in our middle school as well. And looking at the Connecticut Music Services Therapy, we have really been targeting our populations of students with autism in our transitional classrooms, and they absolutely love it. It is a great place for them to build their own self-confidence and really start to work on those relationships. Something that we've also done with the Community Mindfulness Project is had a pilot where they came in to work specifically with the adults in the school. So we had them at a middle school and 2 different elementary schools, and the feedback we got was really phenomenal. Teachers were feeling very stressed, and after an hour of some sort of meditation, they were able to come in. We had an 86% improvement in going from uncomfortable feelings to comfortable feelings by the end of the session. They're fabulous. Community agency, if anyone is in the Norwalk area, I would highly recommend to utilize them. One of the things that we did, Mr. Pennington, next slide, please. One of the things that we also did is, as we came in, we recognized when we did our SHAPE assessment that there's just trainings that are needed for our mental health staff. And so one of the things that we wanted to do differently in Norwalk was just not train our mental health Norwalk Public Schools staff, but also ask all of our school-based embedded clinicians to join us in that, and our community agencies to join us in that. We are also very lucky to have relationships with our community agencies in case there is a crisis, where we have relationships with 2 different community agencies where their clinicians will come and serve our adults while the mental health professionals within the school service the kids. So we really created this great working relationship with them. And as a result, we had them attend our trainings. So we were able to do a few different trainings in the last year. All of our mental health staff was trained on the CSAG threat assessment. We also had a 3-hour training from Dr. Christine Montgomery from Clifford Beards on psychological first aid, which was a phenomenal training for us. We had a full day training on risk assessments. Everyone was trained in risk assessment as well as CALM, so your access to lethal methods. And we also had 211 come in to talk to us about how we can follow up. How can they support the needs of our kids? So really honing and focusing in on when our clinicians need those tier 3, how they can utilize and access them. The other thing that we've been working on is taking care of our adults, because again, we recognize how much post-COVID, we focused so much on our kids and we didn't necessarily focus enough on the adults taking care of the kids. And we as educators, we just are burning out in general. So really wanting to focus and hone in on you matter to us, and looking at creating some trainings for them on how they can provide their own self-care and resilience, how some of those things can be incorporated into a tier 1 level within the classroom, and then also providing some mindfulness and adult wellness trainings for them. So that way they remember that it's okay to take care of ourselves first. So often as educators, we put the kids above ourselves. We are going, but it's just a reminder that we are just as important as the rest of the students, and we want our educators to feel that within the work. Next slide, thank you so much. So one of the other great things that came out of the SHAPE assessment was the need for resource mapping. We really in Norwalk have a very diverse population here. And so when we went over what kinds of needs our community has, we found that there were many different areas. So we developed a flip book, which is a 43-page resource guide that helps our families, our outside agencies, and our students find services that they need. We felt it was very important that this be offered to our families in English, Spanish, and Haitian Creole. Because we do have a diverse population here. So this was kind of the start of building some of those relationships as well. So Mr. Pennington's going to show you what the resource mapping looks like. And these are the different categories that came up. So when we were looking at youth crisis, we were looking at what are IOPs, PHPs, residential placements, and then all the different types of services for our youth. We also wanted to make sure that we looked at adult and community services, including immigration, because that is such a concern for our population. In addition to that, one of the things that we recognize here in Norwalk is that sometimes not all of our families are comfortable culturally going to see a clinician or a therapist. So we did create a four pages of faith-based groups where they can also go and find some support, because the most important thing is that our families and our scholars are getting the supports that they need, regardless of where they're from. So we have been able to push this out through our Parent Square, so all of our parents have access to it. The schools have access to it with the QR codes at their security stand, so that way when parents come in, they can just click the QR code and be able to do this. We have a poster of it in City Hall, and it's something that we also shared with all of our community mental health providers. So we've gotten feedback already that our community mental health providers are actually using it a lot as well, and the care coordinators are using it to help connect our families to services. So this has been a big win for us. One of the reasons why we turned it into a flip book and made it electronic versus something that you can print is the minute that you turn it into a PDF, it's an old document. So we wanted to make sure that this is something that we could upkeep with. We've already had some requests for early childhood that we will be adding in here. So we wanted to make sure that this was a live document that we could always go back to and use, and that our families and community had resources to that was accurate. And as you saw within there, it provides what type of insurance they take, a description of the program, languages they speak, and contact information. So it really takes a lot of the barriers away for our families to access services.
And I just want to add, it's also a major resource for our schools. As we did the SHAPE assessment, one of the big pieces that seemed to come up was, well, as a school, how do I know what's available for students and families? And this has now become a resource for our guidance counselors, our social workers, our principals, assistant principals, where they know at their fingertips what are some of those other resources that they can use to support students and families. So it has been a game changer. I'm really interested as a district, if we were to give the SHAPE assessment again, to see the impact of this resource in the schools and community, and how we scored low on our initial screener, what would be the impact of that as we move into our next phase.
Yeah, and
Go
also
ahead,
just to
Robin.
chime in as well, one of the things is that we're actually giving this to teachers as well. So when they come in for a meeting, a teacher parent conference, and say, I have a concern, they can refer them right to the Norwalk Help site versus using a middleman. Social workers and counselors sometimes get a little held up. So this just creates less wait time for parents to access services. Thank you, Mr. Pennington.
No problem. And then our superintendent has been able to partner with Norwalk, the city of Norwalk, Norwalk Acts, and Silver Hill Hospital. And they're actually completing a mental health gap analysis now that will look at some of what do we have in place, but what's really missing. I think sometimes you don't always see what's missing. So through that partnership, they're going to be completing, they're going to be providing us with a report that will allow us to continue and build out the next phase of resources and support for the district and the community. In terms of impact, this really comes from our Mid-Fairfield. If you saw, they're our largest partner. They're in many of our schools. And you can see the number of families and individuals that they have supported from July to December of last year, and for different components, different reasons, but they're also supporting parents. They're also doing home visits. And so it really has been just important for us as we're looking at the impact of building out these systems and supports, that we're constantly looking and connecting and build and continuing to adjust as we go. What's next for us as an organization? We've started with our tier 1 supports and really continuing to support all of our schools, continuing with some of the adult wellness work that we piloted. We've done it in small pockets, but really continuing to build that piece. And our providers are giving us feedback around the different types of trainings that they need. And then one of the pieces, a lot of our work was focused on K-8, really moving DESA into our high schools as well. We have 4 high schools. How can we move that work? Because high school students need that support as well. If you saw, we do have a lot of clinicians and extra support in our high schools, but in terms of screening to be proactive for our high school students, it's an area that we want to continue to build and grow. We have the QR code to our Norwalk Helps manual that you're welcome to look at. And do you have any questions about our process over the last, what I would say is 1.5 years? This is, I mean, we're really excited about some of the outcomes from the behavioral health pilot and looking forward to next steps.
Thank you so much, Norwalk. This was wonderful, Robin and Robert. The comprehensiveness of this approach, starting with the data and hearing from the students and the families to drive your systems and structures, is just amazing. I want to borrow you for some other districts to learn from what you did. I just love the inventory of your interventions. It's just thank you. I will be sharing this presentation. It's recorded, so we'll share this with others who weren't able to be here today. But I think there's so much to learn, and the evidence is in your success in your data. So congratulations.
Thank you.
Thank you so much.
Mm-hmm.
Yeah,
Anybody have any questions from our districts?
yeah, that would be great. We have a few more minutes, and please feel free to unmic or just
I
put it
had
in
a
the-
question. I heard you mention the DESA and Panorama at the same time. So were you using Panorama for the SEL part of their survey component? And if you did, was there, because we're looking to kind of navigate to change. And so I'm wondering if there was a preference or something that you saw between the two.
So our Panorama survey is really our yearly survey that we are looking, like we give it to our parents, we give it to staff members, and we give it to students. But it is really measuring some like growth year over year, whereas the DESA is really being used to measure, individual students' need for more support. I don't know if the Panorama would really give us the data to support with more intervention, so to speak. Not the way that we're giving it.
Okay, so you're probably doing like the school climate surveys
You
in the
got it.
Panorama and not using, because they do have the SEL component as well. So
Yeah.
that's why I was wondering. Okay, thank you though.
Yep.
We've used the Panorama to kind of hone in around sense of belonging and increasing our tier 1 around that for our kids, especially in the middle school level.
I know Norwalk is one of our new LEAP districts. We added 11 districts this fall and was really excited. And the LEAP team, the district coordinator and LEAP home visitors are really doing a fantastic job and out there doing their home visits. And I imagine these resources are so helpful for them. Can you talk a little about how the cohort of home visitors and their work connects to this?
So in terms, we do have 3 LEAP coordinators. Our deputy superintendent is our lead in that work, and they're focused, which I think is really nice, has been in our schools with the highest chronically absent students. So we have them in our 2 comprehensive high schools, and in one of our elementary schools that has a higher need. And they have been an amazing resource in the district, going out into the homes and going out into the community has been great. But then also the connection comes when they see a family that is having a specific need. A resource like Norwalk Helps is something where they can then, right in that moment, share some possible resources that they could use. And then they also would connect with Robin as our district liaison, and she can always support and help out. So I think that we're grateful to have our LEAP coordinators. I think that they have really been helping with, if you were to look at our high school data in particular, we're seeing nice drops in our students chronically absent. And I think that I always go back to impact. Is this what we intended, and how do we know? Because a lot of times we'll say, yeah, it is, but it always goes back to, but what's the data say? And I mean, qualitative data is great, but the quantitative is really where I think you can see some of that piece. And so we're seeing the quantitative data with our high schools.
Excellent. I know we just gave some extra funding for the alternative ed program as well, because we know LEAP has an impact for all grade levels, but has a significantly more stronger impact in our high school students. So thank you.
Yeah, when I shared Norwalk Helps with the LEAP coordinators, they were ecstatic. Like, this is amazing. Oh my God, you mean we don't have to search for these resources? So they were really happy to have that. And it's just been a really overall positive feedback that we've been getting from people who are using it.
Yeah, when you mentioned adult wellness, my mind automatically, I don't know why, but it went to the families and the parents and their wellness and connecting with them and helping them get to resources too. Kim, did you have a question?
Oh,
Yeah,
can I go?
Oh yeah, go ahead, Rob.
I just don't want to lose the train of thought. One of our tier 1 SEL resources that we're using has a connection for parents. And so I think that was really important as we were trying to pull out a resource to use in our elementary schools that are also sharing with the parents, so that everyone is speaking the same language. And it's really building, the word I want to use is coherence, across students and families and schools. And so it's been a great connection. Go ahead, Kim. I'm sorry.
No, not at all. Actually, I was just going to answer the question in the chat regarding the DESA. They're using the DESA Mini and the supplement. So it's both. And then I just want to, oh, go ahead.
Oh, no, sorry. I was just going to say, we also, with those community partnerships, we have a leadership committee that meets, and we do parent chats at least once a month, targeting areas that we have done some needs assessments on. So another way that we're trying to improve our family engagement with our community partners.
All right. Chris, do you want to?
Yes, I will close it out. Well, we thank you all for joining us, and we do thank our presenters. Just a great presentation.
Kim, did you have another question? I'm sorry.
Oh, goodness, no. No,
okay,
that's great.
Thank you. I just want to make sure you got everything. And
oh my goodness, my screen. Sorry, y'all.
Okay.
Give me one moment. As we just close out very quickly, just a reminder, our next Tech Tuesday is January 23rd. The registration link is in the PowerPoint. We do ask that if anyone is interested in registering, that you really give them the registration link. We don't want them having the Zoom link, because we want to make sure that they're getting all the notifications and emails, and we can keep track of everything. So please share out, let people know to register for Talk Tuesday. But our dates for the 2025, the rest of the school year, are on the screen. And just as we finally close out, here's our contact information as well. If you have any questions, comments, thoughts, or need resources, you also can reach out to any of us at any time. We do thank Norwalk Public Schools for joining us, Kim Traversal for joining us. We will send out this PowerPoint so you have all this great information, and it will also be posted on our Talk Tuesday website. We thank you all and hope you have just a great day and continue your good start to the new year. Thank you all.